For those of you who don't know me, I'm Helen Campbell, and I'm a bit of an interloper here because I'm a psychiatrist. But I do a lot of collaborative care work, and more recently I've been in a number of, looking out to see if people there's a number of family doctors that I've been actually privileged to work in your offices, and doing more and more of that. And so having that role, being able to go into the family doctor's offices, I've learned a lot from you about the things that you find frustrating, the things that work really well for you. And so that's what I'm going to share with you today, some of the things that I've learned from the family doctors I've worked with over time about what actually increases their resilience. So some of these things you may be already doing, and it may be a matter of just being able to think, good, yes, those things I'm doing already. Do I need to move over? I can stand here. I just feel I'm going to hide if I'm behind there. That's good. Is that better? Okay. Where was I? Right. So some of these things you may already be doing, and it'll be a matter of just reaffirming to yourself that you've already got a lot of these things under control. And for some of you, it might be some new ideas. So first of all, when we look at what is resilience, right, it's a key component of well-being, and it involves adapting to adversity and stress. And I thought this little mole was a really good example, although I'm not trying to imply that family doctors should become blind and full of big claws to get through a day at work. But the mole, in addition to having that, has also adapted a special type of hemoglobin to be able to carry even more carbon dioxide around. So it's about adapting to adversity, because we know we can't avoid adversity, especially in our practices. We deal with stress every day. And when we look at, why is it important to be talking to a group of family physicians about resilience, we know that the well-being of physicians is crucial for their professional effectiveness, as well as, of course, for your own health and happiness. And this was a survey of CMA members who said that 55% said that their family and personal lives had suffered because of their profession. So it was interesting to hear the stats earlier from the survey, which was a lot more optimistic and positive, I would say. And maybe that's a little bit of a skewed population in that you're the type of people who would join a division, and maybe it's a result of the division. But this was a little more sobering here. And this was another survey that was in the journal Hippocrates that said, contrary to this fellow in the picture who's sort of a happy George Clooney look-alike kind of guy here, and he's got this very keen, happy, supportive team backing him up, what the surveys said was that only 44% of male physicians and just a quarter of female physicians were very satisfied with their practices. And that's a little bit shocking, I think. And in my view, family physicians are really the cornerstone of the medical system, and quite frankly, as a member of the public, but also as your colleague, I think it's really important that you play these roles. We need you. And more importantly, we need you to feel satisfied and fulfilled in your careers, as we know that physician job dissatisfaction is a very powerful predictor of leaving your career prematurely. This is but one slide of the causes of physician stress, and I'm sure if we went around the room, we would be able to fill up many, many slides. And you know the stresses that you face every day far, far better than I do. But there were a couple that were struck out as interesting to me. The third one there about the lack of career fit. Does it fit your values? And that's what Chris was really talking about there with his work in Tanzania, that doing something that really fits with his values creates meaning and reduces stress. Or getting into that circle that we can sometimes get into of self-sacrifice, going really beyond what's reasonable, depriving ourselves of good self-care that we would recommend for anybody, and ending up with a bit of a martyr complex, which isn't very good and can often lead to being exhausted. And feelings of being ineffective, that's one of the things I often hear when I'm working with family doctors is the most frustrating times, the bits that cause them most stress is when they feel they're trying their hardest, but they're not getting the results they want to see, or they're feeling ineffective. And then, of course, you can fill in the blank. Each person would have their own set of things that makes them feel under stress. There's a couple of good articles I came across about how to build resilience. One was in the Canadian Family Physician Journal, and the other was the Family Practice Management, and I can give you those references after if you're interested. But several themes emerge when you look at those, and these were the themes here. And we won't go into them in any depth except for the last one there. So the first one about attitudes and perspectives, and that touches also on what Chris was saying about valuing the physician role. You know, we have an important role, and really feeling the full value of that. Maintaining interest in your job, keeping it varied, keeping it interesting, keeping it changing if that's what motivates you more. Developing self-awareness, being able to check in with yourself. How am I doing today? How's the balance feeling? Or how is this week gone in general? Am I getting the right kind of balance of getting work done, but also managing myself? And also accepting our own personal limitations, being able to say, actually, you know, Dr. So-and-so can work so many hours, but not me. I can only work just this much, and that works for me. In terms of balance and prioritizing, so that talks about setting limits and honoring yourself. It matters whether you have lunch or not. It matters whether you get a stretch break and get to move around, get out of the office. And working within your limits, whatever those are for you. And that's the image that I've got up there. Anyone can do a sprint pace. You know, you can do a 10-hour day, 12-hour day, 14-hour day if you have to. And maybe you could do that for a couple of days in a row. But you sure as heck can't do that every day, ongoing, week after week. You need more the marathon pace. So it's not about going flat out, it's about going at a pace that you can really sustain. When I was looking for some images for that, the marathoners looked just absolutely sickly and ill and ghastly. I had to really scan around to find a healthy-looking marathoner. and the sprinters looked great, right? That was but that's just one small race, not every day. In terms of practice management style, that talks about making sure that you've got sound business management so that your business, the actual business part of your work is going well, that you've got good staff that actually are working with you. And if you don't have good staff, trying to not just make do, but either change things up so that it actually works for you. Having effective practice arrangements, working in pairs, getting together. The idea of the division, you know, especially for people in solitary practice, that's just tremendous in terms of getting that sense of collegiality going. And delegating. Sometimes it's easy for us to have a little bit of a complex of wanting to keep taking on more and more and more because we can for a short while. But being able to delegate. And then the last one, supportive relationships. So positive personal relationships and professional relationships and good communication. And if we look at those supportive relationships, of course we're talking about in our personal lives, right? With our partners, our family, our friends, making sure we've got time for them, quality time. It's also about building relationships with consultants, right? Having some specialists that you could phone and talk with and bat some ideas back and forth with so that you don't feel you're alone with these patients. People tell me that when the people who are in multidisciplinary teams seem to really have feel again that sense of not being alone, that they're being really supported. And so I'd encourage you to think about those things, that it's this type of things that we're talking about with shared care models or with an integrated health network where you're actually working with people from other disciplines and sharing the responsibility. Seems to be particularly helpful for people. Have your own family physician and actually see them, not just in name only, but going to get the same kind of care you would actually want to give to somebody else, going to get that for yourself. And then the one that I want to focus the rest of the talk on today is the relationships with your patients. Because that's a hugely important relationship in the office that can be a drain on you and can reduce your resilience or can actually be a source of strength. And so we've got some ideas about how to build strong, effective patient-physician relationships that are boundaried, of course. Does anyone know who this is? He was in the CBC news about 2 weeks ago. This is Dr. Yan So, and he's a family doctor who's retiring after nearly 60, years as a practicing physician in Coquitlam. He graduated from UBC years and years and years ago. And when he was interviewed about his long career, it was interesting to hear what he actually chose to talk about, of his 60 years of practice. He talked about the relationships that he had built with his patients. And this was his quote. "We were taught about the importance of seeing your patient, finding out their problems, not only physically, but emotionally. And that's what's satisfying, to follow what we were taught. These patients I have, I not only treat them, I treat their families, and it's different. What's most rewarding? You know your patient, and they know you." And he went on to say that building rapport was key to his practice. Otherwise, it's very dry, he said. And he tried a very short stint at walk-in clinics, which he said, I don't enjoy it. There's no real connection to the patient. And so for him, he was tying in the longevity of his career, which was what the interview was about, with this sense of connection to his patients. And this is what I hear from your colleagues as well when it comes to their job satisfaction, that can often come from really being engaged with our patients and getting to know them and getting to understand them better. And several of the practice support programs, the adult mental health module, for example, with the CBIZ tools, those give you strategies and tools to be able to do just that, to find out more about your patient, to understand why are they stuck, why are they not getting better, how did they get into this distressed place in the first place, and also talking about the practical things about how to not have your office time management go off the rails at the same time. And I heard I must listen to CBC a lot, because I heard the other morning about the chronic pain practice support program that's coming out soon as well. And I think that's going to have the same kind of tools and strategies to help with that challenging patient population. And so taking the time to do just that, to learn more about your patients, to understand them better, that increases the patient's sense of being seen and understood, and that's therapeutic in and of itself. We don't have to have a solution always, because sometimes listening is just the treatment at that point. And it can reveal pieces of missing information that were holding back somebody's recovery. In a way, it's like moving towards the patients that frustrate us most, when sometimes our tendency might be to want to withdraw or back away or pull back. But leaning into it and getting to know them better ends up often with the patient feeling improved and feeling that it was a more therapeutic encounter, and the physician also mirroring that. It can be therapeutic for both. So happy patients and happy physicians seem to go together. And there was at least one study showing that there was a correlation between when they did satisfaction surveys for both physicians and for patients, that, maybe not surprisingly, physician satisfaction and patient satisfaction were closely linked. And we saw that when we were doing the adult mental health module, that when there was more engagement with the family physician and the patient in such a way that the patient felt truly heard and understood, that both physician satisfaction and patient satisfaction rose. So it's a little bit chicken and egg, and which came first, but I have a hunch that it's probably a mutual feedback loop. So what things can lead to increased physician satisfaction and that sense of resiliency? So what I've heard from the family doctors, mostly in the context of working with challenging mental health patients, having a sense of confidence helps. So, and that's the idea of I may not know how to fix it, but I've got an idea of how I'm going to proceed. I know how to start tackling it, even if I can't fix it right away. Having an approach. A sense of efficacy, that what I'm doing is making a difference, even a small difference. Like we tell our patients, little small goals, and recognizing that even listening is treatment. Being appreciated for the work that we do, that always feels good. Patients who feel listened to and understood are often very appreciative, and it can be amazing how just, you can have a kind of miserable morning going along, and then one patient says, that was really helpful, thank you very much, and that's like a little resetting of the clock in a way. Sometimes it can just help in terms of building that resilience through the day. And making sure that your work is in keeping with your values. And I think that's what we heard with the adult mental health module when we were teaching people about cognitive behavioral strategies they could use with their patients. So it really just felt good to the physicians that were using those to be able to offer something more than just a prescription. Is this the physician or the patient or both? We'll have to see. So it won't come as a surprise to you to know that the physician's sense of professional fulfillment is correlated with their patient's adherence to medications, exercise, and diet. That's probably a pretty obvious one. But how on earth do we get them to that place? And this is where motivational interviewing techniques can come in. And if you ever have an opportunity to do any CME around motivational interviewing, I'd strongly recommend it because it can be changing, life-changing in terms of the interactions you can have with your patients. And basically, it's just looking at the ways we work with people. And these are 3 different styles of interacting with patients, none of which is wrong. It's just about being really conscious and aware of what style are we using at what particular time. Because otherwise, if we're using a particular style at the wrong time, we can get into frustrating scenarios with our patients. So on the left side is the directive style, right, when we're assessing or we're prescribing, and it's a very important part of medicine. Sometimes in this day and age that can be devalued, but really when somebody's life is at stake or we have to lead in an emergency, that is the style that's called for. And on the right-hand side, it's the following the non-directive way, right? When we're listening, we're in that mode of trying to understand a little more, trying to listen, and there's a role for that as well and a time for that. And then in the middle is the guiding. So again, thinking in terms of what a guide does, so the person will have their goal, where they want to get to, and it's the physicians working with them slowly, step by step, to move towards that. And that's really what motivational interviewing is all about, and I'd really encourage you to research more into that or get some teaching about that if you haven't already. We often hear this sort of hackneyed expression as patients as partners. It's kind of trotted out. But really, there's a huge difference if you can actually incorporate that and have it be part of your practice. When some of the reading I was doing that talked about resilience and physician character traits, the character trait of cooperativeness came up as the most closely linked with resilience. And at first I had a bit of a reaction to that. It was a bit like probably how patients feel about compliance, like just be cooperative. and so seeing this trait of cooperativeness there, I sort of reacted against. But really what they were talking about was empathy. And so it's about having a cooperative stance, reflecting that connection with the other person and that empathy. And it quantifies the extent to which physicians are tolerant and helpful, forgiving and principled. And so cooperative physicians can accept and empathize with somebody else's opinion or behavior, even if it's contrary to their own principles, but they don't lose sight of their own principles, and then they're trying to work together to a solution with the patient. And I think it's that sense of shared responsibility and working together with the patient that can lead to more physician resilience in the day-to-day interactions rather than burnout. And so I'll finish with this slide here. I love these 2 different images here. And so in building resilience in yourselves and in your practice, I invite you to look at the role of the interactions that you have with your patients, especially with your most challenging patients, and encourage you to think that making patients partners in their healthcare actually shifts the pressure off yourself to be the one that has to fix it all and come up with all the answers and come up with all the solutions, and that there's a true acceptance of shared responsibility, and that can help move forward to setting small, achievable goals, which are really those dance steps towards better outcomes, and I think towards increased physician satisfaction and resilience. And so I'd encourage you to do the practice support programs when they're offered, or to look further into motivational interviewing, because those really give you the tips and the skills and the tools that you can use to have your interactions with patients feel more like dancing and less like wrestling. But thank you.